Good day everyone, I am Daniela Saneha, a student nurse, and for today's video, I am doing an assessment on abdomen to check if there is any abnormalities. But before that, I am going first to sanitize my hand. After sanitizing my hand, I will going to close doors or curtains to ensure the client's privacy. After ensuring the client's privacy, I am going now to check the client's identity. I am going to introduce myself. The rationale in that is to check if I have the client or the correct client in front of me. Good morning, Mom. I am Daniela Saneha, your student nurse for today. Can you say your name and birthday for me?
March 11.
Alright. Mom, today we're going to assess your abdomen. Is it okay with you?
Yes.
Do you have any question before we start?
No.
Alright.
You want to lift your patient's gown and look at their abdomen. You're looking for the shape, the contour, looking for any bulges, masses, or distension. You can even shine a pen light across it if you need to look for differences. You're also looking around the umbilicus for any redness or swelling, any drainage or obvious herniations. You can have the patient cough or bear down to make hernias more apparent. Also make note of any wounds, lesions, or scars and the details of those: size, shape, color, drainage, etc. Make note of any visible pulsations or respiratory movements, just like we did in heart and lungs. Now we can move to auscultation. Again, this is where it's a little bit different. We want to make sure we listen first. Start in the right lower quadrant and work your way up, over, and down, listening for a full minute in each quadrant. You should hear between 5 and 30 clicks a minute. Less is considered hypoactive, more is considered hyperactive. Now, in order to confirm that bowel sounds are really absent, you actually have to listen for a full 5 minutes in each quadrant. Now, while you have your stethoscope on, turn over to the bell of your stethoscope and listen for bruits over the major arteries. You'll listen over the epigastrum for the aorta, up and to the side of the umbilicus on both sides for the renal arteries, and then to both femoral and iliac arteries. Remember, a bruising is a whoosh sound that indicates a narrowing of the arteries, which is never good. Now that you're done with auscultation, you can move on to percussion. You're going to percuss all 4 quadrants, again, starting in the right lower quadrant and working your way around. You should hear tympany like a drum. Dullness over the liver or in obese patients is expected, but otherwise dullness could indicate fluid, blood, or a mass. Now we also want to check for CVA tenderness. This could indicate inflammation in the kidneys. Place one hand on the patient's flank and strike it with the ulnar side of your other hand and repeat that on both sides. It should not be painful.
Ma'am, please sit. Pwede mo tigatin mo pa siya. Good morning, Habib. Puso pa yun.
Hindi pa. Iba. Tignan mo siya. Ano mo na, iayos mo na ng ano niya. Ang bado. Kamu.
Tapos na ba ka?
Mm-mm.
Okay na.